Do you know or have someone that's been diagnosed of cataract and has been told to prepare for cataract surgery, and this person has been freaking out because of the word surgery? Of course, I understand. Today, I bring you good news. Somebody shout hallelujah. So in this video, I'm going to be talking all about cataract surgery, what to expect before, during and after cataract surgery. Let me just remind us of what cataract is all about, because I know I've made an official video explaining in detail the causes of cataract, including in diabetic patients. So if you know you have not watched that video, in order not to get lost in this video, you have to run back to my YouTube channel to watch that video for better understanding of what I'm going to say in this video. Quickly, cataract simply means opacity of the crystalline lens. This simply means that there is a structure in your eye known as crystalline lens, and this crystalline lens helps to focus the image of an object both at far and at near on the retina. Unfortunately, as one is aging, this crystalline lens also ages. In fact, it is one of the structures in the body that ages as one is aging. So as one is aging, this crystalline lens gets old and cloudy. So when this happens, patients in this category usually complain of smoky vision or dew-like vision. This is usually common amongst patients that are 50 and above. It can also occur to patients that are below 50, depending on your body and your occupation when you are younger. Now in this video, I'm going to be teaching you what to expect before, during and after cataract surgery. I want you to note that cataract surgery is one of the surgical procedures that is painless, easy, and almost with an instant result. This simply means that cataract surgery is not painful. Yes, cataract surgery is not painful. It's only a few people that experience minute pain. Let's say 1 out of 10 patients that went for cataract surgery will complain of minute pain. Others experience no pain. A successful cataract surgery comes with almost an instant result. For the day of the cataract surgery, most hospitals will admit you first, and when they admit you, they run some vital tests on you to confirm you a candidate for this cataract surgery, such as your blood sugar level. Blood sugar level is very, very important. Once you are tested and your blood sugar level is on the high side, most good hospitals will reject you. They will not carry out the surgery on you immediately. Rather, they will refer you to a general practitioner that will help monitor your blood sugar level and then ask you to come back when it is normalized. This is because of the relationship between diabetes and wound healing. You understand, Nabi? They check your BP and they will make sure that you don't have tuberculosis or you are not having severe cough, because during and after few days or weeks of cataract surgery, you are not expected to cough too. So if you are coughing at the point when they want to carry out this surgery on you, they will suspend it. Most good hospitals will not go ahead with that surgery. They will ask you to go and treat your cough and then come back. This is to prevent any form of pressure on the eye, which can subsequently lead to complications during and after cataract surgery. That's another thing to expect. Then after checking all those things and they've confirmed your blood sugar level is normal, your BP is normal, you don't have cough and all that, then they will confirm you a candidate for this surgery. So once you have been confirmed a candidate for this surgery, the nurses will ask you again, which eye do you want to be operated on? Mind you, cataract surgery is done one after the other. They usually don't operate the two eyes at the same time, especially in geriatric patients, that is cataract that is due to old age. It usually occurs in two eyes, but one will mature than the other. So that mature one or the hyper mature one is the one they usually operate on first. So they will ask you which eye do you want to be operated on. They are not asking you this question because they don't know the eye to be operated on, but they want to confirm that you are in synergy or you are following up in what they are doing. Then you, let's say, is the left eye. So the nurses there will place a sticker around that eye, the eye to be operated on. If it's left eye, they will place a sticker there writing left eye. So few minutes to the surgery, they will give you an injection, usually a sedative, through IV, that's through your vein. to help your body relax, and then they will instill an eye drop in your eye, analgesics to help numb your eye. After this, they will wear you a skull cap, that cap that they wear when you want to go for surgery, and patient gown. Then you walk inside the theater room. When you get there, the theater room, or where the surgery is usually performed, looks like a beauty parlor with a chair that looks like that one that they usually have where ladies go to wash their hair. So you will lie in that position, you with your eyes looking towards the ceiling, and a light shining directly on your face or your eye for ophthalmologists to be able to have a proper view of your eyes. This surgery is mostly done with your eyes open. But then, because of that sedative they gave you, your body will be relaxed. Before that time, they already know the kind of surgery they want to perform on you. There are two major ways of removing this cataract in the eye. The number one is phacoemulsification. In phacoemulsification, is like laser. They don't usually do a cut or incision. So the cataract is broken down into tiny pieces and removed through suction. And after that, they replace the cataract with an IOL, or artificial lens, known as intraocular lens. The second type of cataract surgery usually performed on patients is extracapsular cataract extraction. In this extracapsular cataract extraction, the surgeon usually make a small incision through the white part of your eye, known as the sclera, and then the cataract is removed as a whole and replaced with an intraocular lens. The sclera, or the white part of your eye, is sutured back. After that, the operated eye will be bandaged. This is the cheapest in cataract surgery. Phacoemulsification is usually expensive, as it is a modern way of cataract surgery. And this whole process takes less than 30 minutes. Within 10 to 20 minutes, you are out. Now, when you are coming out from the theater room, you are not supposed to bend. So I finished telling you what to expect before and during the cataract surgery. Now, after the surgery, and you are coming out from the theater room, most hospitals will not allow you to wear your slippers into their theater room. So you keep your slippers at the entrance of the door. Then, if your slippers is at the entrance of the door, as for parents, this is where the role of your children comes in. They will be the one to help you wear your slippers. They are not supposed to look down to wear your slippers or to look down to do anything. When they walk into your room where you were admitted, they give you pain relief, antibiotic eye drops, anti-inflammatory eye drop. The antibiotics eye drop and anti-inflammatory eye drop that are given to you is to prevent any form of infection or to prevent the inflammation on the operated eye. Now, when you have gone home, there are so many things you will not do within the first 3 weeks. You have to make sure that you take proper care of yourself. This includes making sure that when you are walking into your room or going anywhere, make sure you don't bump into your door, into anything, or hit your eyes on anything. For the fathers, don't bathe from your head down. You have to bathe from your neck down, and then you can get a clean towel and a soap to wash and dry your head. Don't pour water on your head in order to prevent water from touching the operated eye. Anything that will increase pressure from your neck region to your head, you have to avoid it. For those that can drive, you have to avoid driving at least the first 2 weeks after operation. Do not swim, don't shout, don't drag land with anybody. If anybody wants to drag land with you during this period of healing, leave that land for your own good. And for young men that are sexually active, avoid any form of sexual relationship with your partner at least for the first 2 weeks. This will help healing process and prevent complications. I forgot to tell you that before you come back home, some hospitals, or almost all the hospitals, give you a sunshade to protect that eye, especially from sun and dust. Hence, you are expected to wear this sunshade every day for at least 1 month, especially when you are going out. If you have been booked for checkup by the hospital, maybe 2 weeks after surgery or 3 weeks after surgery, make sure you keep to your appointment with your doctor. This will help the doctor to monitor or manage your healing process and to also ensure if your vision has improved. For the patients that travel far to have this cataract surgery, because of distance barrier, you have to look for a nearby hospital or clinic for post-cataract surgery management. Don't do cataract surgery and skip checkup at least for the first 3 months. At the end of this video, you have learned that cataract surgery is not painful, and cataract surgery is almost always successful unless you are diagnosed of cataract and has been told to prepare for cataract surgery. Then you delay the surgery maybe after 2 years or 3 years. Then you will now go when the blood vessels and everything has been damaged by this cataract. So if you go at this point, you are likely not to have a successful cataract surgery. So if you want to have a successful cataract surgery, go when you were diagnosed and when the doctors have confirmed that, okay, if you do this surgery, your vision can be reversed. Thank you.